So we have Congressman Jim Himes, Democrat of the fine state of Connecticut. He supports this law. Joins us right now. Sir, good to have you. What do you make of these latest developments? I know you're against what the Republicans are trying to do, obviously, but they're apparently running into a potential roadblock on the means by which they're trying to do it.
Well, Neil, let me be clear about something. We've been hearing for a long time, repeal, 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 and then the Republicans realized something a couple of years ago, that if they repeal without an alternative, they throw 20 million Americans off of health insurance. They take us back to a world where if you've got diabetes or skin cancer, you are uninsurable. They go back to a world where seniors are paying more for their drugs. And so they started talking about repeal and replace. And now it's time to put up or shut up, right? I mean, they've got controls of all the levers of government. And that's why you're hearing them say, and I totally disagree with the governor of Arizona, you can't repeal without an alternative unless you want to create the human tragedy of 20 million people being thrown off their health insurance.
But what if they seem to be guaranteeing by the time, and it's always in the eye of the beholder, I grant you, that they will not leave those 20 million stranded, that this could delay the exact repeal date, but it will be pushed back, and by that time a replacement is in there. They've got at least 3 or 4 active plans they're considering. There are grades of differences to your point, but that they won't do that. Do you not believe that?
Yeah, and so let me be clear about where I stand. If they can come up with a replacement that is better, that is more efficient, that will cover as many or more people, that will bring down costs in the healthcare system, they'll get my support. You know, if they can come up with a better deal.
So you would work with Republicans. I mean, the rap, as you know, 8 years ago was that Democrats weren't all that eager to entertain Republican ideas. You are open to do the same for them.
Yeah, and that's a little bit of a misstatement. I was here and I remember, the president worked so hard on 4 or 5 Republican senators, altered this thing. It was not shutting off Republicans entirely. But let me answer your question.
Well, he didn't take one of their ideas. He didn't take, the state boundaries. He didn't take, the ability to file lawsuits off the table. All of that stuff was stuff that was just a non-starter.
Right, but let me be clear about this. If the Republicans come up with a plan that is better than the one that exists today, I'm wide open to it. Here's the thing, Neil.
What do you think has to be fixed, though, Congressman? That's what I want to focus on. Many in your party argue there are some problems. What would you address? What do you think is an area you're open to fix?
Version 2.0 or the next rollout or the next initiative should really be about cost control, because what Obamacare achieved, and I'm sorry this is a fact, it covered a whole lot of people who didn't have coverage before. And it made for a better situation if you lose your job, if you have pre-existing condition, if you have an unemployed 25-year-old.
I understand that. What would you fix? What do you think has to be? Where were the wrinkles?
What needs to happen is measures to keep the cost growth in the overall industry down. And that means different delivery models, where you're not paying by the drink, you're paying for actually good outcomes. Open-minded about things like competition across state lines. There are some good ideas out there, but let's go back to what's being discussed here today. And you heard the governor of Arizona say it. We're going to repeal, and we have these vague notions. Vague notions are not a plan. And as I told you, I'll support a good plan, but they've had 7 years. They've had 7 years to produce a plan for somebody to think about, and they've produced exactly 0 plans.
But that's a little disingenuous, right, sir? I mean, you're assuming that not a single Republican offered an alternative. At least 6 did, 3 quite seriously. Now, I don't know the mechanisms by which things get done in the House or the Senate. You're vastly more familiar than I am. But it's not as if they were just lying about that. For whatever reason, it never came to pass.
But the important thing,
But I do want to be clear. Here's where my question is, sir. I'm not clear. Do you then support a measure that, let's say, calls for repeal of the way the law is now, with a guarantee that the 20 million are protected and that the forces are in place for pre-existing conditions, keeping kids on policies a little longer, the kind of stuff that was very popular with both parties from the outset?
Neil, you're describing exactly what the president-elect said. President-elect Trump said, I'm going to keep all the good parts, all the stuff that you just described, and we're going to take away with all the bad parts. Now, we may disagree about what the bad parts are, but my God, if President-elect Trump can come up with something that keeps all the good stuff and does away with all the bad stuff, I will be standing in line to help him out with that. I happen to know enough about the industry to know that that is likely impossible. And the fact that you haven't seen a comprehensive plan, I know we talk about tort reform and competition. Those are all ideas we should debate. But a comprehensive plan that actually continues to cover people with pre-existing conditions and increases the number of Americans with coverage, we have not seen anything like that.
All right, so let's sort of play this out now, whether it's going to be done through a budget resolution measure or some other, mechanism. Do you think that your party, the Democrats, will be open to seriously fixing this, just as Republicans say that they're open to repealing and replacing this? I mean, where do you predict this will ultimately go?
Many of us would be enthusiastic about fixing the things that we know are a problem in the healthcare industry, some of which may be associated with Obamacare, some of which are just associated with the industry. Look, the fact that an EpiPen costs thousands of dollars is not an Obamacare problem. It's a problem with the industry. If there's a plan to help fix those, again, I know there will be lots of Democrats in line, but if there's a plan that is going to throw millions of Americans off of their own health insurance, that's not something we're going to go along with. And by the way, I think that most Republicans will understand not just the human tragedy, but the political catastrophe associated with doing so, which is why you're hearing all these plans about we're going to repeal and then 3 years are going to go by and then we'll have a replacement. Look, that's a recipe for chaos, and it's driven by the fact that they know that they don't have a plan yet to do that.
All right, very quickly, I mean, yesterday when Democrats were pushing this reaction to the Republican repeal efforts, they said that this is all about making America sick again. Do you think that went too far?
I think if you're talking about throwing 20 million people off of their health insurance, if you're talking about taking away the Medicaid expansion, which has provided coverage to millions of people in this country who are our poorest people in this country, and all of a sudden you say that's going away, and let's be clear, repeal means that's going away. There is no question, Neil, that people will be sicker, people will die.
But they're sicker now, right, sir? I mean, 7 out of 10 top disease killers in this country, the death rates have climbed. I'm not blaming that on the health care law at all, but it's occurring despite the law. So don't you think it's a tad disingenuous on the part of Democrats to argue that Americans are going to get sick again when the mortality rate has been reversing and the death rate from these diseases has been increasing?
I mean, let's not get into individual diseases. There's a lot less heart disease than there used to be. There's more dementia than there used to be. The real issue here is
heart-related disease deaths are up. Now, again, I'm not blaming the law, sir. What I'm blaming is the extremes that both parties go to, including Democrats yesterday with let America sick again. Do you think that goes too far?
You know, it's sort of funny to hear people, saying that's going a little too far. When I remember just 8 years ago that the Affordable Care Act had death panels in it that was going to send grandma to an early grave. I will agree with you.
Well, maybe extreme,
rhetoric,
Congressman, but I also remember that I could keep my doctor, and that was wrong, right?
The rhetoric is the rhetoric, and on both sides engage in rhetoric. But we're talking about something much more serious here, which is if people get thrown off their health insurance, they will get sicker. There's no denying that.
All right, we'll watch it very closely. Congressman, thanks for taking the time. We appreciate it.